I think it's important as a patient starts off on the journey of being treated for cancers that they sort of have a game plan of how they're going to make connections with their doc and who they can bounce issues off of. Sometimes patients are a little bit nervous about asking the oncologist about a particular thing, and I've had many, many patients come back and see me with symptoms that are clearly associated with chemotherapy: numbness of the bottom of the feet, darkening of the skin, certain kind of rashes, but they never mention it to the treating oncologist, and they put up with it, waiting until they get back to see the primary care doc. If there's a game plan in place and you know you're going to be calling me every couple of months, or if there's an issue, and I think it's important for the primary care doc to give the patient the liberty of saying, call me anytime. You don't have to wait until something goes on. If you got a question, if the family has a question, your wife or your daughter, your son, feel free to get in touch with me. I'm glad to take those calls anytime. When issues come up post-treatment with patients, my recommendation is that they generally contact their primary care physician. One, unless the patient is really savvy and knows that their issue is a gastrointestinal issue, that pain is cardiac and not gastrointestinal, or gastrointestinal and not cardiac, or pulmonary and not cardiac. Unless they're sharp enough to know that, I think it's very important for them to bring those issues to the primary care doc, let the primary care doc sort them out and give them the best direction about what to do about a particular symptom. Sometimes it requires nothing more than some minor treatment by the primary care physician, but patients will often get a chest pain and they want a cardiology consultation, when in fact the problem is not heart at all. So I think the primary care physician is very important in sort of teasing out what the issues are and how best to address them.